So here we have cases, basically. The two charts, the two of the three that are on the right there and look very, very similar, is just the chart we're accustomed to seeing with confirmed cases, including the 7-day average. It's remarkable how much alike they look, but the one in the center there is actually for the state, and the one on the right is for DeKalb County. So they're different quantities, different scales, but very, very similar kinds of results. And you can see that we're up much higher than we'd like to be. The chart on the left comes from, well, it's the same data from the state, but this is how the AJC has begun to report it, because on November 4th, the state began reporting antigen testing. That's the rapid result test. There's been a lot of question, a fair amount of controversy and comment about how to report that and what it really means and so on, because it's less accurate, and it's kind of accurate in a different way, I think is a fair way of saying it. And so some people call antigen positive tests positives, some people call them probables, some people blow them off altogether and say, well, the only thing you do with a positive antigen test is go get a PCR test and confirm it. Regardless, the AJC is reporting it this way, and regardless, you can see that even this cases counted the way they've been counted from the beginning are above that peak. The point here being, one of the important things out of all the data and all the talk that we hear about COVID, one of the important data points is cases and rate and direction of new cases, and you can see this is all wrong. You'll remember it's actually been 5 weeks since I gave the last report because of the way our calendar runs. And so the last time we were here was a week or two before Thanksgiving, and we were saying things had been pretty good. They were, everybody was looking forward to Thanksgiving with some trepidation about what would happen and how that would go. If you see that little dip to the right-hand side on the main chart of the left there, you see that one little dip. That low point is Thanksgiving Day. And so you can see right from that point, right from that week, we've been kind of going straight up, and that is something we want to fix. This is new to this presentation. I added it for this time because to me it's another really important point. When we talk about flattening the curve and trying to stretch this thing out until we get to widespread vaccine and herd immunity from other sources, it's because we want to make sure we have hospital capacity to handle those who do get ill. And so on the left side, this is statewide data, and it's hard to read for those of you in the room, but it tells us what percent of capacity we are at statewide on various kinds of hospital facilities. The key being, when we get to 100%, we have a real problem. People start getting turned away from hospitals. They have to get out faster. They may have to wait before they can get in. The good news is we're not quite there yet. We're not quite even to the same peak that we were in midsummer, but we are headed in that direction. The right-hand side shows Region D. That's a state public health region, and that's the region that we're in. And if you can see those numbers there, again, you see I think it says 81% of total beds. So if and when things get tight, hospitals can do what they did before, which is to convert some beds for other uses. There's ways to add additional capacity. You might remember at the World Congress Center there were some temporary facilities. Some hospitals have trailers and tents and things they can do in a pinch to serve more people, but in any event, it leads to people suffering from other illnesses and needs to have to not be served, or people who should be doing routine testing for various things put that off, and that's not without consequence. So this is a big deal, and how close we are to capacity is something that a lot of public health officials are concerned about now, and rightly so. So this is a number that I watch closely. The bad news, if you look at that bottom left-hand chart, there's kind of a table over the line there. But that number, that chart, obviously, that trend line has been rising, and every day for quite a while, the new daily number has been higher than the average, which is what causes it to rise, and that hasn't changed for quite a while. So we will expect to see that trend continue in the wrong direction for a little while. We'll come back and mention some more about that in a minute. These are the two transmission rate measures that we've talked about. They're sort of predictive. They're sort of a retro view. They look back in some ways. So they're informative. They don't tell us exactly what's going to happen, but they definitely tell us what is happening, which is that we're somewhere around 1.2, which means for every person who has the virus right now, they're giving it to 1.2 people, which means for every 100 people who have it, they're giving it to 120. For every 1,000, it's 1,200. And so you can see it's a pretty rapid rate of growth. We've actually come down slightly in the last week, but we want to see that number get to 1 and well below 1, which is when the spread is shrinking. And finally, I included the deaths in this presentation, which I haven't done before. Obviously, it's a delicate thing to talk about, and I think most of us know someone who's been impacted this way. But again, from a broad view from the public health perspective, deaths in this latest surge, if you will, have not risen. You can see two different measures of it, both by the date reported and by the date of death. Both have a little bit of backward look to them, because it might be, especially that bottom chart, it might be some time before a person's death from COVID or related to COVID would be reported. So it's good news that that number is not rising. It could be for several reasons, and we're going to learn pretty soon which of those reasons it is. We're hopeful that it's because of therapeutics and treatments, early detection, all those things. Most of the biggest number of people who are being infected right now are in an age group that is not as subject to severe cases of the disease. All those things may be helping. But it may also be that this surge in cases, we know, and we've seen before, historically at least, cases lead to hospitalizations, a 2 or 3 week lag. Hospitalizations lead to deaths on about a 2 to 3 week lag. And so we've seen cases rising, we've seen hospitalizations rising. We're hopeful that maybe some of the treatments and things that we have available to us now are preventing some of the deaths that might have occurred earlier during the pandemic. So it's not a pretty picture, and it's especially worrisome because we're still in the holidays. We're headed for another big holiday season, as you're aware. People are going to be tempted to travel, gather with family, gather with other groups, go out, all those things. Really, it's pretty simple. I mean, we know now what helps, and we certainly know that if you individually are concerned about your own health, you can all but guarantee your health. If you want to stay in, if you want to stay away from people, if you want to eliminate the possibility of getting the disease, you can get pretty close to 100% certainty. If you choose to go out, if you choose to travel or gather or all those things, there are things you can do to minimize your risks, but you should be aware there may be other people around you who are not doing those things, and that's part of the calculus that you have to be okay with should you go out in public. So just want to urge you, because we won't be back together again until this time in January, to please take care, to please do the things that you know you can do. It's hard. We've all been through it in the last few weeks, and we've got a few more weeks to go, saying no to things, turning down opportunities, just not getting together with people and taking some unknown degree of risk that you or they or everyone involved will wind up with this disease. So we're headed for vaccinations. They started today. We saw the news with people in the United States actually being vaccinated, and it's a remarkable thing they're doing with the logistics of getting that out and getting people as fast as they can. But we still need at least half the population to get those vaccinations, which take a month to become effective before it really starts to turn the tide from that. So in the meantime, we have to do what we can do as individuals to tamp it down, and especially to flatten that curve so that those who do get sick can also get treatment.